Have two speakers. Kwan, Head of Communicable Disease Branch, Center for Health Protection, and also Dr. Gladys Kwan, Chief Manager of Hospital Authority. The two doctors will give you an update of COVID-19 cases as well as HA's situation. Dr. Kwan. Good afternoon. We have 1,409 patients in our facilities. 183 of them are new cases. For those requiring isolation facilities, 460 patients are in isolation wards, 40 patients are in second-tier wards, and 432 patients are now in North Lantau Hospital Hong Kong Infection Control Center, and 150 of them are new cases. As for new cases reported yesterday, we recorded 5 patients in critical condition and 2 patients in serious condition. Altogether, we have 30 patients in our hospital in critical condition and 21 in serious condition, and 2 patients in critical condition are receiving intensive care. We also reported 3 death cases as of yesterday, namely 1 male, 2 females, age 71 to 96. 2 patients were residential care home residents. The first one, a 96-year-old female patient without any vaccination record. She had dementia, as well as hypertension. She was put under quarantine in Asia World Expo, and on the 17th of July, her test result was positive. She also had fever and vomiting, and on arrival at the A&E unit, her blood oxygen level was low. Breathing support was given. She was admitted to hospital, and her lung condition continued to deteriorate. We prescribed an oral antiviral drug to her, but she passed away yesterday. Second patient, a 85-year-old female patient who lived with her family members. She had no vaccination record. She had DM, hypertension, cardiac disease, and dementia, and also metastasis of a tumor in her lungs. She had poor appetite and she couldn't eat, and upon admission in the hospital, she was found to have kidney stone, leading to inflammation. And after an operation, she was injected with antibiotics. And during her hospitalization, whilst hospital screening was performed, she was found to be positive. And because of complications, she passed away yesterday. The last patient was a 71-year-old male patient. He suffered from renal disease as well as Parkinson's disease, and he was admitted to hospital because of convulsions and urinary tract infection, and the admission screening showed that he had positive results, and he did not react well to the drugs prescribed, and he passed away. And as of yesterday, 117 patients have recovered, including 110 who have been discharged. And there are also 5 more patients found positive by admission screening, and 6 patients and staff members sharing the same ward have been listed as close contacts. And for staffers, altogether 25,639 have been infected, and 25,053 of them have returned to their posts. In a surgical ward of Sha Tin Hospital, a 75-year-old male patient was found to be infected with COVID-19 on the 23rd of July. And upon investigation in the hospital, we have identified 3 more male patients aged 69 to 83 and 4 other staff members who were confirmed as positive as of yesterday. We are now investigating the linkage between these cases. As for all the staff members and patients that are in stable condition, patients have been transferred to the Prince of Wales Hospital for isolation treatment. The hospital would also arrange for all staffers and patients to get tested, and the ward mentioned above has suspended the intake of patients, and the ward has been thoroughly cleansed and disinfected. The hospital will continue to monitor patients' situation and will continue to liaise with the Center for Health Protection to report on the situation. The hospital authority is very concerned about nosocomial infections in hospitals. And we hope you understand that, the pressure we face because of increase in number of cases in the community, as well as high transmissibility of the Omicron variants. Very often cases are asymptomatic and testing and confirmation are not easy. We often remind our staff to be vigilant, and we also adopt various measures to prevent nosocomial infection. And we also like to appeal to the public to work with us and minimize the risk of transmission of the virus in hospitals. First of all, as far as staff members and patients in public hospitals are concerned, we have stepped up testing for HA staff. Apart from daily RATs for staff members starting last week, hospitals have also made an arrangement for staff members who are required to take care of high-risk patients, such as those in hematology ward and cancer treatment wards. These staff members will be subject to PCR tests twice a week. In the past week, the arrangement yielded quite good results, and we were able to identify positive cases in time, and this would help us monitor the situation. This week, we will further extend the arrangements to rehabilitative ward and also psychiatric ward. In line with the overall direction in fighting the epidemic, we will encourage more frontline staff members to take a PCR test, and we'll try to expand the scope as much as possible. As for patients, during the first and the third day of their stay in hospitals, they would be required to take PCR tests, and upon identifying infected patients, they would be isolated and treatment would be provided. We hope that through enhanced testing for staff and patients, we can minimize transmission in hospitals. Next, on vaccination, we would very much want to help our patients to get jabbed, in particular long-staying patients. Some patients are of the view that they are quite frail and old, and they are quite reluctant to receive vaccination. We have all along been encouraging them to get vaccinated, and I would also like to take this opportunity to appeal to family members of these patients. Please encourage these patients to get jabbed, and if they wish to do so, we can arrange vaccination as quickly as possible. On visiting arrangements, we are now looking into measures to minimize the risk of visitors bringing in the virus to the hospital system. We will step up the PCR testing requirements for visitors so as to better protect our patients. We also again appeal to family members of patients that when they visit the patients, they should observe personal hygiene. And if you have any discomfort and if you feel you're of a high-risk group, please refrain from coming to the hospital. Finally, we also appeal to management of hospitals to remind their staff to be vigilant, and all measures should be taken to minimize infection in hospitals. And if there are confirmed cases in hospital wards, these cases should be reported as quickly as possible, followed by epidemiological investigation to curb transmission chains as quickly as possible. These measures are taken with a view to minimizing the chance of bringing in the virus to hospital wards and to reduce severe and death cases. I appeal to everyone once again to work with us and observe these arrangements, and please understand that we're facing a very difficult situation. For those who have yet been jabbed, please get vaccinated as quickly as possible to protect yourself and your family members. I'll give the floor to Dr. Zhang. Good afternoon. We recorded 3,906 positive clinical cases, including 1,449 PCR positive cases and 2,457 RAT positive results successfully confirmed via PCR. We have 224 imported cases, including 193 PCR positive cases and 31 RAT positive cases. As mentioned by Dr. Kwan, we recorded 3 death cases today, and cumulatively, we have 9,259 cases since the start of the 5th wave. Among the 224 imported cases, we have 129 cases picked up at the airport, 77 picked up at quarantine hotels, and also 18 cases picked up only after the subject have left quarantine hotels They are from 39 places, and 6 countries imported more than 10 cases, including UK, 44 cases, US, 22 cases, Thailand, 21 cases, Australia, 16 cases, the Philippines, 12 cases. As for the remaining 33 places, they have imported fewer than 10 cases.
For care homes, I probably misread the name of one of the care homes. It should be the YWCA 聖愛之家 Home of Love, and there are 15 who have to be quarantined. And also the Kowloon Women's Welfare Club, Wong Chung Kin Memorial Hostel for the elderly. There is 1 staff member and 1 resident who tested positive, and 4 have to be quarantined. Today, there are 6 care homes for the elderly and 3 care homes for the disabled that have to be quarantined. And they are a Christian family service, Onyu care home. There is 1 resident who tested positive, and 2 other residents have to be quarantined. PLK, Long Go K Sing Elderly Daycare Center. There is 1 resident who tested positive, and 4 other residents have to be quarantined. Hoi Yut Home for the mentally disabled, 4 testing positive, and the other residents of the same floor have to be subject to quarantine. PLK Zheng Yikji Care Home, 9 have to be quarantined. Helping Hand HSBC Lok Fu Care Home, there is 1 resident who came down with COVID. 11 residents have to be quarantined. And PLK Siu Ming Care Home for the elderly, 1 resident testing positive, and 1 other resident has to be quarantined. For schools, today's Monday, they're reporting the cases over the weekend on Friday and Saturday. There are quite a number of them. There are 649 schools that have reported 1,112 cases, covering 941 students and 171 teaching staff and students. For these 1112 cases, most of them tested positive on Friday afternoon or Saturday or Sunday. And each day, on average, they have reported 220 to 320 cases. Today, the positive cases stands at 233. Over the past 7 days, 430 schools have reported 2 or more COVID positive cases. 8 schools have 8 schools have to be suspended for 1 week. Yan Chai Hospital, Lo Chen Cho Si Primary School in Tuen Mun, Class 4B, 20 students. 3 students come down with COVID, and they have to be suspended for a week. Shun Tak Fraternal Association, Li Shao Ki Secondary School, 1A, 33 students, 4 testing positive, suspended for 1 week. St. Rosa Hospital in Kowloon City, Class 4B, 30 students, 3 students testing positive, and they have to be suspended for 1 week. PLK Tin Ka Ping Primary School in Taipo, there are 2 classes there. 3B, 25 students, 3 COVID positive. 5C, 26 students, 3 positive. These 2 classes have to be suspended for 1 week. 6 Yuan Ho Ai College in Tuen Mun, 26 students. In 2C, 4 came down with COVID, and this class has to be suspended for a week. Zhengguano Government Secondary School, Class 3C, 35 students, and 5 students testing positive has to be suspended for 1 week. Lam Tin Methodist Secondary School in Guntong, 5B, 21 students, 4 testing positive. There are 7 schools there. There is another one, Kai Si College, 1A class has been suspended already, and they are reported one more student who has not gone to school. Class 5A, 23 students, 2 students plus 1 teacher testing positive. We advise that this class be suspended for a week. And there is another one, Hoa Yan College on Kowloon side, 5Y, 27 students, and 3 students have been suspended for a week already, and there is one more student testing positive. And this student, along with a dozen or so other students, were reported today. There is a volleyball class, 25 students, 4 come down with COVID, and there is a choir class. There is a junior and middle class, 27 with 4 testing positive. So the extracurricular activities, 29 for the volleyball classes, and the choir class, middle and junior, they are advised to not go to school. On July 20th, they had a choir session for the 2 sessions, the 2 classes. Maybe there was some infection going on. They had their mask on during the choir practice, but volleyball class, they didn't have any mask on. So much for the schools. Now for subvariants, we are monitoring the trend, the BA.2, 0.12, 0.1. There is a bit of increase to 2.7% out of the overall scheme of things. BA 8.4, 0.5, 1.4% or thereabout. Recently, there are some senior citizens who have been vaccinated at home. They're not really care home residents. We urge the members of the public to urge those unvaccinated family members to go get inoculated. Now, with these variants, inoculation, according to the WHO, will certainly be of help. The vaccines are against the Omicron subvariant, and because these can guard against severity and even mortality. If one feels discomfort, one has to be tested. If they test positive, they have to declare their test result so that we can we can have the antivirals prescribed to minimize the death and other severity. All right, it's now time for questions. Please identify the organization you represent. Gentleman in the front, please. Doctors TVB. Dr. Kwan, you mentioned a moment ago about the visitation, the visitors. There may be some more stringent requirements. Are you going to do the same way as the care homes if they want to visit someone in the hospital? Will there be a requirement for PCR test within 48 hours? Will that present any difficulties if you insist on a 48-hour PCR test? Dr. Chuang, there seem to be quite a lot of students who come down with COVID. There are 3 or 4 in a class who test positive. Are you worried that with the surge, there will be more outbreaks in schools? And the Kowloon Hoa Yan College, and you mentioned the volleyball class and choir, there are quite a number of students testing positive. Now, the caseload at the moment is about 4,000. For these activities, that mask-off activities, would you advise them to carry out these activities and keep the mask on? Thank you. I mentioned a moment ago that in hospitals, we've seen some infection clusters. So for staff members, patients, and visitors, we have to be treading carefully there. In terms of visitation, we are still at the discussion stage, but we will have regard to the SWD's requirements in terms of visits. Now, this is one of the areas that we have regard to. Now, in terms of PCR tests, certainly that would cause some inconvenience to the visitors, but we are aware that we are having the visitation arrangement, and the family members are really cooperative there. In some cases, for serious cases, for the emergency situation, we certainly would exercise our flexibility. Like they can conduct an RAT test, and thereafter they can follow up with the PCR test results. So in terms of the visitation, if there isn't a new arrangement, we'll certainly bring you up to date.
In relation to schools, we've looked at the figures reported by schools, and the trend is in line with the number of cases received as reported in the community. So when there is a rise in the number of cases in the community, there is a similar rising trend in schools. The RAT tests required of students and teachers every day helped curb major outbreaks in schools, because whenever we identify a cluster, no matter how small in schools, if there is a risk of further transmission in the school campuses, we would advise class suspension. And for the majority of cases after the relevant classes have been suspended, there hasn't been any further transmission. So this will help maintain extracurricular activities and other activities in schools in general. Next, from Now TV. First, about the arrangements at the airport. We can take designated taxis to designated hotels starting today. And about the 100 taxis available, do they come from the anti-epidemic fleet? And if so, would it impact on the supply of taxis in general? And has there been a discussion between the CHP and the Transport Department as to how contact tracing be conducted if a passenger or if a taxi driver gets infected? And also about the confirmed case of Sharton Hospital, when was the index patient identified, and what were their symptoms? Do you estimate that there has been transmission in the hospital, and how many patients and staff members are being quarantined? As for the choir and the volleyball class in YN College in Kowloon, is there any correlation with the early outbreak in Class 5Y? I understand for the anti-epidemic taxi fleet, the drivers have received the relevant anti-epidemic training, and they've been trained to wear a mask and other protective gear, for example. And since they are required to take confirmed cases to certain places, we have prevention control measures for them, and hence we don't think there is a need to conduct contact tracing in relation to these drivers and passengers. But of course, they are subject to frequent testing. As for YN College in Kowloon, previously in that class, one more case was identified who also attended the choir. He might be related to other students, and he could be related to earlier student cases as well. About the male patient in Sharton Hospital, our understanding is that he had been to Prince of Wales Hospital for an examination, and on return to Sharton Hospital, another PCR test was conducted, and he was found to be positive. As for the source of infection, we're still investigating into it. There are altogether 25 patients and 20 colleagues working in the same ward, and at this moment, the patients and staff members have had the PCR test conducted and results are pending. As for taxis, I don't have information at hand. Next question, third row. I'm from Cable. Good afternoon. About taxis for confirmed cases. Now, passengers not knowing each other may take the same taxi to designated quarantine hotels. Would that increase the chance of cross-infection? And when taxi drivers go to designated quarantine hotels, would there be a risk of transmitting the virus to taxi drivers hand the community. And about the case in the surgical ward of Sha Tin Hospital, would HA be able to identify these 4 staff members and see if they have had any contact with other colleagues? Did they share a meal, for example, or did they gather? And would there be a chance of transmitting the virus to other wards? This morning, I did not listen to the session of meeting with the media, but according to the press release, the Secretary for Transport and Logistics expressed that, say, if somebody arrives in Hong Kong from another place and shares a taxi with a friend, then there shouldn't be a problem. For taxis, I think that for this arrangements, similar prevention and control measures would have to be put in place, since they are required to take confirmed cases to hotels. They should observe these measures. And we also conduct contact tracing in relation to clusters in Sha Tin Hospital. We don't have information at hand, but we're still in the process of investigating the link between these cases. Next. Commercial radio, good afternoon. About schools, about the choir and volleyball class of YN College, did the students have contact with each other? Why is it that for the choir, the cluster, the infection rate was high? Did they take off their mask and share a meal? As for Kaisi Primary School, did the 2 cases relate to each other in any way? As for the taxi service, since they would take inbound passengers, would that increase the chance of transmitting prevailing overseas subvariants in Hong Kong? As for the intermediate choir in the YN College, there are 73 students with 27 infected. As for senior class, 11 students with 4 infected. So the percentage is more or less the same. And so whether there is any linkage, we need to conduct further investigation, in other words. As for the anti-epidemic taxi service, I have nothing to add. Next question, this lady in green.
Whether the stepped-up PCR test requirements at hospital for patient staff and visitors will increase workload and affect other services, and how effective do you think the new requirements will be to stop transmission? Second question, how serious is transmission risk inside hospital right now? Thank you.
Sorry, is it your first question is whether the increase in the testing would increase the workload of our staff? Is it the first question?
Yeah, and will it affect other services? And how effective you think these new requirements will be to stop transmission?
Oh, okay. Thank you for your questions. We all know that the sensitivities of the rapid antigen test is much lower, much less sensitive than the PCR test. So that's why we have imposed of this new arrangement. In fact, the workload we anticipate with which we can manageable. So I don't think that will be affect our usual services. And we think, as we have just mentioned, it really did help us to early pick up those positive cases. With the early confirmed cases, then we can isolate no matter the staff or even the patients, and so that they can get the appropriate treatments. And also we can stop the spread within the hospitals.
All right. Next question. On the left-hand side, this reporter in black, I'm from AM 730 about YN College. You mentioned some students apart from the 3 students in 5Y. Were the cases you just referred to new cases or cases previously infected but you did not disclose? Did any of these students take part in both the volleyball class as well as the choir, the intermediate or senior choir? Do you have information about the classes the students were in and about visiting arrangements for public hospitals? You said that you're exploring this option. Is there any timetable when this will be implemented? Will there be a reference made to the Social Welfare Department's arrangements? And will the arrangement be implemented across the board? And also for taxis, the Secretary mentioned acquaintances. That's according to the passengers' self-reporting. What about those sharing the same taxi ride? Should they get infected, would they be listed as close contacts? And is there a requirement for them to have come from the same country? For example, if they carry different subvariants of Omicron, and if they share the same ride, would you be able to say that the risk is minimal?
Kowloon YN College. There is an intervening weekend on Friday. There was someone from the choir, and today there are quite a number of students from the choir. 4 testing positive. 1 belongs to the choir. For the others, they're not 5Y students. So this affects 11 classes. And most of the classes register 1 or 2 who are either the volleyball students or the choir students. So this cluster is actually caused by the extracurricular activities. We haven't seen any transmission in the classes. For anti-pandemic taxis, I've got nothing to add. As to the visitation over the past 2 years, we do appreciate the importance of visitation to the patient's recovery. So as I said, we're going to be looking at how we can enhance the testing. There will be further discussion going forward. We are not intending to have any across-the-board cessation of any visitation, only that if there is any cluster in a ward, the visitation will be suspended. We will certainly bring you up to date on the new arrangement. Next, gentleman on the left, please. Ming Pao Daily. Dr. Chuang, about the Kowloon YN College. Is this one of the largest clusters in recent times? The choir, the volleyball, do they belong to the same cluster? This question is for the HA. Last week, you enhanced the PCR testing for the staff members. How many have you picked up among the staff members? How soon are you going to be extending this to all staff members? Do you think that you will be able to cope with this quantity of testing? And day 3 PCR arrangement, is this a new arrangement? How soon it's going to start? Why do you choose day 3? Right. Kowloon YN College. This is a relatively large cluster in recent times. There are 29 from the volleyball class. 4 have tested positive, and they have stopped going to school. For the choir, middle level and junior level, we have advised them not to go to school because of transmission. We haven't seen any apparent transmission in other classes. Of course, we don't like to see this happen. Now, for the testing of the staff members, we have picked up something like 8 cases. As to whether we're going to be extending this further, we do have the plan to broaden this. Now, of course, you are concerned about the capacity, whether we can have the capacity other than the hospitals. Certainly, there are other private organizations that can assist. We will be considering along those lines. Day 1, day 3, we see that on day 1, people may be asymptomatic, and for the first couple of days, the viral load begin to increase, and we will be able to pick up the virus. So day 3 testing, we're already doing this. No further questions. This is the end of the press conference. Thank you all very much.